This is Mary from Bingo Physical Therapy, and today I want to talk to you a little bit about having problems with your pelvis or your sacroiliac area, which is this area here where our hip bones come together with our tailbone and create what we call our sacroiliac joint. And so that's one of the things that I treat the most, and I think there's a lot of misconceptions sometimes that people have severe back problems or even disc problems when they have pain in that area, because when that spot is not behaving correctly, it can cause pain that radiates down into your leg, your cheek, even into your hip. And so sometimes that's confused with you having a disc problem. So I wanted to talk to you a little bit about that and let you know that there are ways that you can address that and carry on without it being so life-altering. So many times if you have problems with that particular area, you struggle with prolonged sitting. So those of you that get in a car to travel and you feel miserable, when you get there, oftentimes that's actually coming from your sacroiliac joint, and you can prevent some of that issue by getting out and walking or stretching or changing positions every so often. So the holidays are about here, people are going to be doing some traveling, and so I suggest that every 1 to 2 hours you get out of your vehicle, and even if you just stand at the side of your car and do a couple of movements, just doing some marching or doing some up on your heels or up on your toes, I'm sorry, or doing some little squats, something like that, you're using muscles that have been left in the same position and not actually actively working much for that time that you're sitting in the car. And so those sorts of movements should help keep you from being miserable when you get there, because if you have trouble with prolonged sitting and you go to stand up, as you move from sitting to standing, oftentimes that causes pretty severe pain, and then you have trouble taking off and doing your walking. So that can be an issue for you. So a couple things that you could do to address that would be, one, if you're getting a chance to sit somewhere, even if it's at the edge of your car seat, and you can cross your leg like this, you can push your knee down towards the floor, and you should start to feel a little bit of pull in your cheek. And then you want to keep your back straight and then lean forward somewhat. That will go ahead and stretch a muscle in your cheek that oftentimes is feeding into your pelvis going out. And so a gentle stretch for about 30 seconds in that area can really help make you not have the problems that you may otherwise experience in that area. So I would definitely recommend stretching on both sides for 30 seconds and maybe doing 3 repetitions on each one as one of the preventative things from you having that problem. Another thing that I would suggest you do would be to maybe lay on your side, and you leave your knees stacked on top of each other with your hips bent a little bit, and then you leave your feet touching and raise just the top knee up and then back down nice and slow and controlled. This is called a clamshell, and it works one of your glute muscles without using some of the other muscles. So it really strengthens one that can typically get weak on us when we do too much sitting or just aren't doing movements that require us to use that muscle. So when you do these, you don't want to raise your hip up so high that you're rotating at your back. You want to make sure that your trunk stays in a nice straight position, and you keep your stomach a little bit tight so that when you raise your knee up, it's only your hip that you're working. So that stretch too can be another thing that can help you with trying to get your pelvis to stay in alignment. So those are ideas for you to give a try if you happen to be struggling with some of the symptoms that I mentioned, or if you're going to be hitting the road and doing some traveling. Do some standing and walking intermittently, do some of that stretching here in sitting, and then maybe when you get where you're going, you can go ahead and do a few of those clamshell type of movements, and that may help you have a lot better holiday season. So good luck with that.